The NHS is not what it used to be when I started working within it. We are enormously challenged and suboptimal outcomes occur. My name is Dr. Svilena Dimitrova. I'm a consultant neonatologist, and I'm very happy to put my name and title to everything I have to say. However, I have requested for my face to be blurred because I don't want to be recognized on the street by strangers, and I'm worried about potential repercussions due to the sensitivity surrounding this case. I've worked in more than 15 hospitals in my career, and I've worked on 5 surgical neonatal units, and these issues are endemic. We can see issues that have not come to light with regards to the circumstances at the Countess of Chester that we suspect have played a very big role in the increased incidence of deaths in those years. What it has definitely led to is huge fear amidst especially the neonatal nursing body. I have never seen so many nurses resign as I have seen in the past 18 months.
An experienced neonatal nurse at a UK hospital wanted to speak up, on condition she remains anonymous.
I'm a neonatal nurse. I work in a level 2 unit and I have done for at least 10 years. I do love my job, but since this case, it's made me and others quite worried. I think there's a general fear speaking up. The case has had a negative effect on our profession. It's made us more worried about what the parents might think. I think it's alarming how they've thrown allegations at Lucy. I realise how easily it could have been one of my colleagues. Me. What's gone on with Lucy is very close to home.
One of the methods Lucy Letby was alleged to have used to attack babies was injecting air into their stomachs.
Even if we had a theory that a baby collapsed because somebody injected lots and lots and lots and lots of air into their tummy, which would be actually quite technically difficult to do, a competent team would have gone and aspirated out within the first couple of minutes of the resuscitation of the baby.
When I talk to neonatologists, they say that's just ridiculous. And the reasons it's ridiculous, the tubes are tiny, and to inject enough to cause some sort of catastrophic result, I think A, would take far too long, and B, almost certainly be absurd. But also, when you use a bag and mask over a baby's face, when you're resuscitating them, invariably air will go into the stomach.
Lucy Letby was also accused of injecting air into the baby's bloodstreams, causing an air embolism, an air bubble in a vein or artery, which would lead to collapse or death. During the investigation, the prosecution's lead medical expert saw in the baby's case notes that an unusual skin discoloration had been observed. He discovered in research that air embolisms can cause skin mottling. This expert, a retired consultant pediatrician, had specialized in treating children rather than premature babies.
I would argue that the people who should be qualified to be medical expert witnesses should be people currently practicing within that particular speciality or recently retired. Babies that are born prematurely function in a very different manner to older babies, children, and grown-ups. Our speciality is so different, and it is really hugely inappropriate for non-neonatologists to be giving evidence.
The pediatrician expert, whose findings were backed by a second expert witness, pointed to a research paper written in 1989 by one of Canada's top neonatologists.
They relied on a research paper that was very old by a chap called Dr. Shu, who'd written this and showed that certain skin changes can happen when there's air embolism. Well, he was called to the appeal. And at the appeal, he said, the skin changes that happened weren't the precise ones that I described.
Dr. Shu Li came forward after the original trial to tell the court that his theory had been inaccurately applied to the Letby case.
The proposed causes and mechanisms of her murdering these babies were just implausible. And that's a very polite way of putting it.
Nearly all but one was premature. Most were less than 3 pounds. One was less than 2 pounds, I think, and described by one of the nurses as one of the tiniest babies I've ever seen. Now, that doesn't mean Lucy Letby didn't harm them. It does mean as they were probably at high risk of death.
No one saw Letby harming any of the babies. The case is almost entirely circumstantial.
With Lucy Letby, they're alleging she used a whole load of bizarre methods, but the most damning thing to me is if you were going to use all these methods, you would have researched them. But she didn't research any of these methods. How would you expect a neonatal nurse to come up with this without leaving any evidence of researching it on the internet?
I have no idea whether Lucy Letby was innocent. But if there is evidence of guilt, then it's not been presented to the courts as far as I'm concerned. When there are significant system flaws that lead to poor patient outcomes, the easiest thing to do is to scapegoat an individual.
If this conviction is unsafe, I think it would be probably the biggest miscarriage of justice in the United Kingdom.